Hello, good morning once again.
Good morning, sir.
Morning, Sam.
I hope you're all doing well. Okay, so today we'll be looking at the quantification of health commodities. And, we talk of quantification of health. What do we mean by quantification? Can you have a rough idea the meaning of quantification of health commodities? Can anyone be of help? Okay, when you talk of quantification of health commodities, anytime we want to make a purchase, you don't just go out and then buy. You decide on the quantities you want to buy and then the costs that those items will cost you, how much it will cost you. And then you also will look at when it will be delivered to you. So when you talk of quantification of health commodities, it's a process of estimating the quantities and costs of the product required for a specific health program, and then determine when the product should be delivered to ensure an uninterrupted supply for the program. So what it means is that anytime we want to procure, when we talk of the quantification of health commodities, is about estimating, is about estimation of the quantities and the costs of products required for a specific health program. And when we talk of specific health program or service, we know what it is because we have different health programs such as the HIV, the HIV prevention. You have teenage pregnancy program where you play the advocacy role, where you try to educate those in their reproductive age, especially the teens, how to prevent unwanted pregnancies. And these programs, anytime you want to embark on such program, be it education or screening, what you do is that you decide on the commodities that you are going to use. You plan by estimating the materials, educational materials that you require, and probably in situations where those materials are not readily available, you will also indicate, because you prepare your budget. Normally, you prepare the budget, indicate these are the items, these are the things that I will need, and this will be the corresponding amount. Then you also indicate when that product must be supplied or must be delivered for you to have smooth, uninterrupted supply for the program. So you get the items that you need. So all that quantification of health commodities is how we estimate the quantities and the costs of products needed for a specific health program, and also determine when that product should be delivered. Let us look at the importance of quantification. What do we gain by doing this kind of activity or performing this activity? the quantification. So saying quantification is important for informing supply chain decisions on product selection, financing, procurement, and delivery. So it is important. One of the importance of the quantification exercise is to give information, is to make sure that supply chain, you have enough information to take decision, to take procurement decision, especially on product selection. When you talk of product selection, you have many products to choose from. So which one would you want to? And so there are many factors that are taken into consideration when selecting a product. So some of the factors would be the price, would be product availability, would be the convenience. Okay, take into consideration a lot of factors. And then financing. So you need to look at the financing, the product that you are choosing, looking at the costs, and then the time that the product or the materials that you are requesting may be needed. Do you think it can be financed at a time? So timing is of essence. Sometimes we say, okay, this program, Vivian, I've seen your hand up. Vivian, or it was an error. Okay. So we're talking about financing. So timing is of essence. Vivian Opoku, you've also raised your hand. Hello. Okay. So we're talking about the importance. We said that it gives information, it helps the supply chain make decisions on product selection, financing, procurement, and then the delivery. So with the procurement, it helps you to know the procurement processes that you will follow, the steps that you will take. When it comes to bidding, how you are going to do your bidding, and then the delivery. So the delivery will determine the kind of the transportation mode, the kind of transport system you adapt to ensure that the product gets its final destination. So timing is of essence. There are some products that you think that it is urgent. Maybe you will consider the most fastest transport system. And so that is what the quantification does. And then the result of quantification exercise help program managers too. So once you do the quantification exercise, the results that you get enables managers to, one, identify the funding needs and gaps for procurement of the required commodities. How does it help? A health program, a particular program, assuming as midwives, the program that you may be interested in may be teenage pregnancy. So if you are on teenage pregnancy program, how are you going to, so we're saying that it helps you to identify funding needs. On the top of funding needs, you're talking about the things, the funds, the financial support you will need to be able to have smooth program, and then the gaps for procurement of the required commodities. So when we talk of the gaps, you identify a product. That is the product that I want. These are the quantities that I will need to be able to work, but these are the funds available. So once you draw your budget, you are able to determine the funding, then you realize that when you realize that you cannot get all the funds, that is where the gaps comes in, the differences. So when you talk of the gaps, you're talking about the differences between the actuals, the estimated and the actual. So you've estimated that your total budget should cost, let's say, 100,000. But at the end of the day, you realize that the funds available is just around 800,000. So you have a gap of 20,000. Where do you 20,000 from? Please, please. If we are not talking, mute yourself. Other than that, I'll move you to the waiting room. And then you talk of saying that it also helps you to leverage the sources, amount, and timing of funding commitment to maximize the use of available resources. So anytime you embark on program, you look at your source of funding. Where are you going to get the funding from? Is it going to be sponsored by the Ministry of Health? Is it the government sponsoring it? Or you using internally generated fund? Are you being supported by some NGOs or what do you call it, donors? Because sometimes some of the program, when you embark on program, some of the items you use normally come from donor agencies. So what will be the source? So once you do your quantification and everything, you are able to take advantage of different sources. Then the amount, the total amount that you will need, and then the timing of funding commitment to maximize the use of the available resources. So you are always looking at timing of funding. You see, timing is of essence when it comes to procurement, because the funding, if you needed money for a program urgently, and somebody gives you a promise that, okay, this year I don't have funds, but next year, it may disrupt, it may interrupt the activities that you want to embark on. So when you do your quantification, you're definitely going to do costing, and then you also look at the timing. If you put them together, it helps you to know where you are going to get funds, so you take advantage of funds, available funds, and then you execute your projects. So we're continuing the importance of quantification, saying that it advocates for additional resources when needed. So when you do your quantification, when you are able to determine the quantities that you will need, with it cost, this is more of budgeting. Then when you identify a gap, you are able to request for additional resources. So the resources here will be both human, non-human resources. And then you also know, it will help you to know when these resources are needed. Then it also, another point that it helps a supply plan to coordinate procurement and shipment delivery schedules to ensure continuous supply of commodities. Then here when we talk of develop a supply plan, when you talk of what is supply plan in the first place. So you're talking about the supply chain activities. You're talking about how you're going to procure and deliver. You're talking about the identification of the items that you need, procurement of those items, and distribution, how these items will be delivered to the user department. So when you do what it does, is that it helps you to it ensures continuous supply of commodities, because you are able to estimate the quantities that you will need for a period, assuming you need it for next year. You are able to determine that next year these are the items that we will need to be able to deliver. So it helps you to community.
A sister of my bought diaper. I think the one in the sack.
So, and the next step you talk about is that let us look at the key steps in the quantification process. Give me some few minutes. Okay, so I'm back. So let us look at the key steps. Please, I'd like to know from you that whatever we've done, do you understand? Do you have any question or contribution to make before I proceed? Please, if you don't understand it, let me know from the onset. Don't wait till I'm done. Then you can't telling me you didn't understand. So I'm asking once again, do you understand what we're doing? If you don't, let me know, then I explain before I continue.
Yeah.
Understand now?
Please, may I know the importance of quantification? Is it in
Please, I can't hear you, so speak louder.
Please, may I know whether the importance of quantification, whether it is in a sequence form or like it can just be like listed like the way you listed it?
I don't understand. We are talking about importance, and it's not sequential. Importance, they are all, so you have to arrange anyhow you arrange it. It doesn't follow any sequence.
Okay, thank you, sir.
Okay, so normally it's not. You can even talk about is the steps, the processes in procurement that you can say that they follow in certain order, because you cannot skip a process and then you come back. That is what follows. But even in a examination, sometimes the telepathy wouldn't be there if you mix them, but you still get all of them, because once all the steps are there, fine. You might not it may not follow chronologically, but at the end of the day, you've made your point. So don't think about how it is arranged. Just get the understanding. Okay, thank you. So let's look at key steps in quantification. Quantification is not one-time annual exercise. It's a continuous process that requires ongoing monitoring and routine updates. So assuming we're saying that it is a continuous process. It's not just one time annual. Assuming this year, we discover a new disease trend or disease pattern this year, and the quantification done last year, that is the forecast, more forecasting that was done for that the treatment of that ailment or medication for that treatment, we've realized that it's low. What we can do is to update it to increase the quantities to be procured, or the quantities that we're going to procure. So it is not static. Okay, it is a continuous process. We've made estimates, but as the year goes by, you find out that certain things need to change. You see new things happening. You see variations. Things that were considered normal, you realize that it may go out of control. So when it happens like that, you need to make changes to the quantities that you've estimated. So the first step in the quantification process is preparing for a quantification exercise. That is the preparation. So the first step in quantification is preparation. And what goes into the preparation? Let us look at we're looking at the preparation process. The first step is to assemble a quantification team. So a quantification process is not a one-man show. It's not one person who sits somewhere and decides for the entire program. No, you have a team of experts. So you assemble the team based on the requirement of the program and then the expertise required. So the next step is you describe the program. So if the program is, let's say, teenage pregnancy, you need to describe it. What is teenage pregnancy? What goes into teenage pregnancy program? The things that you require, you need to explain. You need to describe it. And then you look at the program performance. How is the program faring? How is the program doing? Looking at the previous year's exercise. So you analyze, you try to evaluate the program. So you pick teenage pregnancy program. You pick like the previous years, the performance, the activities that you've been involved. How have they fared? Then you look at the program performance as well. For instance, there was this attempt to introduce female condoms into the market, and I don't think that program is working, because we used to. I used to manage a family pharmacy, and you realize that that particular product, when you buy them, sometimes for, I don't know, no, I'm not at the retail and I'm at the wholesale. I was at the wholesale side. So you push the product and it will be there. Anytime you do stock count, you see that those items are there. But the milk condoms, you see that one moving faster. Sometimes you run out of stock. So surprisingly, that is one thing that probably per hour my upbringing, I don't like this day Valentine. Okay. Though when we're in school, we're celebrating it as a feast. You know, when you attend Catholic schools, the saints every day, sometime the feast of the, so Valentine's Day was, and because of that, they've removed it from the Catholic calendar in Ghana, because of the way people have made that. And on that day, 14 around the 12:13, if you don't take time, all the condoms in the shop will get finished. from the wholesale, because wholesale we buy is one of the biggest pharmacies in. So you box us, you take them, and they will patronize it. But the female condoms will still be there. So if you have a program, if you're a program manager for maybe family planning, and you're looking at the contraceptive and the female condoms, if you are estimating, the quantities you estimate for male condoms will not be the same as the female. No, that will be different, because that you look at the performance of the product in the market. Then you also look at the policies of the organization. You know that if you find yourself in those of you working in the Catholic hospitals, you know that when it comes to contraceptives, I don't know if they still have them there, because I know it's a no-go area. They are family planning, they believe in the natural way and all those things. So when it comes to, I don't know, do you have like facilities, like the big facilities like the Holy Family hospitals across the country? Are they allowed to have contraceptives in the facilities? They are not. So over there, if you are having a program and the program is about teenage pregnancy, then contraceptive is out of the question. So the policies, you look at the policies of the program, and then the institution itself. Then you are now also looking at the strategic plans. Normally, strategic plans emanate from the top. So what is the strategic plan of the service? So you're also looking at the Ministry of Health or Ghana Health Service. What is their strategic plan on, what do you call it, teenage pregnancy? That one will inform you on the kind of product to purchase. Then you define the purpose and scope of the quantification exercise. So the purpose, so if you look at teenage pregnancy program, what is the purpose for teenage pregnancy program? Is to reduce the unwanted pregnancy among women in their reproductive age, especially those in school, those young ones that cannot fend for themselves. So that is how, so you should have a purpose, a reason, and then the scope. So when you're talking about teenage pregnancy, what is the scope? What is the limitation? If you want to embark on program, what are the do's and then the don'ts? What is the boundary? What can you do and what can't you do? So you need to look at it before you decide on the product and then the timing. The next step is you collect data. You collect required data for forecasting and supply planning. So based on the program, as we talk about the program performance, based on your previous performance, you are able to forecast. So you collect the data. What kind of data are you collecting? You are going to collect information on the exercises, on the previous exercise or ongoing, to be informed on the next action, the next line of action when it comes to procurement. So this will enable you to know that, okay, last year our consumption has gone up for particular product, or we need to, looking at the situation, we need to intensify outreach programs to educate the youth. And normally, when you go out like this to the secondary school, sometimes that is why sometimes they liaise with organizations like the MTN. Sometimes I have seen, especially the big facilities like Confanoche, Kolebu, partnering with industry like MTN, Vodafone, Telecel, and some of the companies to do what do you call it, advocacy drive. So when they go out there, even when it comes to blood donation, you see some of these corporate bodies being involved. And then this will help you to do your forecasting. So when you embark on such programs, what do you need? You need data, and the data will help you do your forecasting. It will help you to determine your procurement activities. So most quantification teams have 6 to 15 members. So when you are building the quantification team, as I indicated, it's not one-man show. You need a lot of people on board, and you don't just pick them for the sake of, it's not family and friends. Members are expertise. So definitely the managers of the program will be involved, the procurement department, they will be considered as well. And then you're looking at the warehouse managers, because when you buy these items, you need to have a place to keep them. You need to ensure that you have the appropriate storage, what do you call it, devices in place. Then you look at service providers. There are instances that when you are embarking on a program, you don't do it alone. You involve other people. Sometimes you can involve different laboratories. You can involve other groups that will provide you with services. Then you also involve donor agencies, because these people, you see, when you look at our health system, most of our funds, most of our support come from donor agencies. And so when you are doing quantification, you cannot bypass them. You cannot ignore these group of people. Then you have the implementing partners. Anytime, for instance, if you are implementing teenage pregnancy program, definitely you have the schools. Normally you have the secondary schools, and then the GHS, they are in their teens, and that's the focus group. And so you partner with the schools, you partner with GES to help you as it is implement your teenage pregnancy policies. And they should be part of it to guide you on the kind of item you can. And then you have the technical experts in quantification. You have people who have specialized in this. So you involve all these people in the team. You select people based on their expertise to the team, so that you can have smooth, you can have effective and efficient team. So all team members should have the following knowledge and skills to complete a quantification exercise for health commodities. As you select them, all the team, these are basic. These are what they call it, skills, knowledge, and skills that I'm talking about are basic, that everybody must have. Once you are put on a team, so once you are put in a team, you're supposed to possess these knowledge, and then expertise in a specific program area, and knowledge about the commodities and how they are used. So you don't appoint somebody to lead what do you call it, teenage pregnancy program. No matter how the person's qualification or expertise, if the person is not expert in that particular program. So the fact that probably I'm a lecturer and does not mean that you put me on teenage pregnancy program. That is not my area. But then if you co-opt me into it as a procurement specialist, I will accept it, but not as the program's one way. No. So you make sure that the people you bring on board are people who have knowledge about the commodities. Because when you bring an expert like a midwife, okay, public health, maybe all those who are involved in family planning, if you bring them on board, they may have more knowledge, more understanding about the commodities and how they are used. Then members should be computer literate, computer literacy and proficiency, use of Microsoft Excel spreadsheet or software programs to create and manage databases. So the people you bring on board, you make sure that they have the, you don't bring the BC people, no. You need to bring people who are IT inclined. They will be able to manage, they'll be able to use Microsoft Excel, spreadsheet, and software programs to create and manage databases. So that is why even at the nurses, you are made to learn a bit of ICT when you are in the nursing school. I don't know when in the nursing school you were made to do, but I know that those degree students at Garden City, ICT is part of their, they do ICT at level 100, they do it. And then there are some courses that, you see, something like English, com skills, I think they do it twice because you realize that universities don't teach English. And there, so over there, you are supposed to learn them yourself. But then we've also realized that we have a problem, we have a challenge as a country in that area. Other than that, you will churn out graduates who cannot write simple sentences. Surprisingly, we get students who come for interview with good grades at grade 8, and they cannot write simple sentences. It's strange. So the university has taken it upon itself to make sure that at that basic level, they try to improve their writing skills and then the language skills. So the same thing when you are bringing somebody on board to onboard a team, you make sure that they have these requisite skills, IT, knowledge in ICT, and then commitment to conduct ongoing monitoring, data collection, updating of forecasting data, assumptions, and the supply planning data to update the pipeline database. What this means is, you see, there are times people want to be, every program, people are interested in being named or being put on a committee. But when it comes to working, doing the work, they don't do. People lobby to be put on the committee. You put them on the committee, and then what they are supposed to do, they don't know. So make sure that the people you put on the team are people who are committed. They have that commitment to work, to do the work, be able to do monitoring, be able to collect data, and then update the data and update the forecasting data and assumptions, because it is a continuous process. It's not like you do it once and that is it. So it needs constant monitoring and evaluation. Then you also should employ people with the ability to prepare and present quantification data and methodology, and then the final quantification results to key stakeholders and implementers. So presentation is key. CODeL, I don't see, because I know that the regular students, anytime I'm passing by, you see them doing a lot of presentations, especially courses taught by the business school lecturers. I know that one of the HOD, the HR woman, she likes presentations. So most cases you see them doing presentation, and it is key. This is something that a lot of people lack, because your work, especially as a midwife, you do advocacy, you go out, you do presentation, you need to, what do you call it, explain things to people, educate them. And if you don't have good presentation skills, it affects the message that you are delivering. So it should be someone who can be able to present data, the result that you have gotten from the quantification. You should be able to explain to stakeholders and then implementers. That is only when you get funding. Because if you are unable to present your results properly, there's difference between you getting the results and you presenting it. Sometimes you may have beautiful results, detailed, but you are unable to present it as you should. And when you do that, it will affect you. So let's go to step 2. And before we go to the steps 2 of the quantification process, may I know if you have any question with regards to what we've done, especially with the preparation and what goes into the preparation. Any question? Hey, today you people, you are doing magic. You understand? You think? Do you understand what I'm doing? You are confused. Let me know. Let me know your views. Do you
Sir,
understand
we
what I
understand.
say? I understand.
Sir, I understand.
Good. Because
It's
somebody.
clear to me.
Okay. Thanks. Let's continue. So we are looking at step 2. Step 2 is forecasting. Okay. So what is forecasting? Who can help me with the term forecasting? When we say forecasting, what is your understanding? What is your take when you say forecasting?
Sir, like anticipating.
Forecasting. Anticipating is expect.
Sir, estimating or predicting.
Yes. So
For
So you make projections. I put somebody in a waiting room. Is that she's still there or she's hesitant? Okay, seems she's hesitant, so I should have brought her back. All right. So the forecasting is about you making estimates, making projections. And how do you make projections? How do you estimate quantities and the costs? So when the second step in the quantification process uses the data collected during the preparation step to estimate the quantity of each product that will be dispensed or used during each year of the quantification. So here you use the data that you've collected, the consumption data and everything from the preparation period to make your forecast. So whenever you are making a forecast, in this case, it's not based on emotions. It should not be based on assumptions. Forecasting here should be based on data, accurate data. Should be based on information that you have collected and analyzed. So let us look at the forecasting process. One, you need to organize, analyze, and adjust the data. So when you talk of organization, what goes into organization? So you are going to go for the data, the information you need. You need to collect all the information, like you talk about teenage pregnancy. What is the prevalence level? How many teenagers get pregnant within the year? Okay, unplanned pregnancy, unplanned pregnant within the year, within the catchment area, you pick it. You get maybe you also get information about their age group. You get information about their knowledge about maybe contraceptives, their knowledge on reproductive health and all that. Then you analyze them. After analyze the data, after analyzing the information, you can now adjust the data. After analyzing it, you know, okay, based on the information that I have collected, these are the things that I would need. Then you can make projections. Then the next one is you build and obtain consensus on the forecasting assumptions. Because you are working in a team, it is not one-man show. You need to build consensus on the forecasting assumptions. How do you build consensus? You have other experts. Each and every one of them is in the team because of their expertise. So it's not like you sitting somewhere and saying that these are my estimates. No, you need to build consensus based on the information that you have collected. Then you calculate and calculate the forecasted consumption for each product. So you need to calculate. So with for a program, you may have different products under a program, and that's one. So we're saying that you need to calculate the forecasted consumption for each product, then compare and reconcile results for different forecasts. People will bring their own forecast. People will bring their members of the team will make their own assumptions and other things. So what you do with it, you need to compare, and then compare and contrast. Then you reconcile the results of different forecasts because people may have their own differences. So you need to still ensure that you've reconciled the different forecasts. So during preparation for a quantification exercise, team members begin to collect program background information, as many types of data from as many sources as possible. So the program background information is very, very important. You pick teenage pregnancy. What is the background? Why? You need to get information. Why there was the need to embark on that project. And then you need to get the various types of data and then the many sources from many sources as possible. So let's look at the various types of data, the 4 types of primary data for forecasting. When making a forecast, you need 4 types of primary data for that. So one is the demographic data. Who can help me with the demographic data? What goes into the demographic data? Who can assist me? When I talk of demographic data, what goes into them? You are doing research, okay? And I know some of you have already submitted your questionnaires, and you have demographic, what do you call it? Data. Then what goes into it? Okay, Deborah.
So please, the age, marital status.
Okay, I understand. You see, sometimes I ask my project students the demographic variables. You always bring in marital status, but sometimes you can see that the work that you are doing, marital status has got nothing to do with it. You may not analyze it. Okay, unless you see when you bring it in, then you analyze it and then you can pick a trend and say that maybe women who are married often exhibit these kind of characteristics. And therefore, marriage has impact or has no impact on certain behavior. But you realize that you put marital status, number of children, all those things there. But if you read the analysis, you don't see any relation. It has nothing to do with the work. So for me, when I see it, I take it off. You need to, if you cannot, it has become something, we've picked a format and yes, somebody has put it there. It is gender, age, population, location. Okay, these are the demographic, what do you call it, data or you need. So they are data on population characteristics, growth, the population growth, and trends. They are not usually recommended for forecasting health commodities needs for procurement purposes, unless they are combined with other sources. So when it comes to health commodities, yes, there are some that you would need, some are gender-based, others are not. But most health, especially with equipment, yes, we still have gender-based and non-gender, but normally it's not something which is often used. Then we have the morbidity data. And then morbidity data is on estimated incidence or prevalence rate of specific diseases or health conditions occurring within a defined population group. So when you are doing estimate quantification, let's say for malaria, what do you call it, drugs, you are going to look at the prevalence level. You know that in the South, research shows that the prevalence level in the South is more than in the North. Okay, so if you make estimates, if you have this data and you are making your quantification, general quantification exercise, you forecast your estimate, you have more the quantities for malaria items in the South are less than those in the North, then people are going to question the kind of data. So, research, one secret about research is that I'm the one doing my research. You are not there. So you cannot question me. But there are areas that people will question you. That is the methodology. So that is why for those that I supervise, I'm always on the methodology. And for the methodology, you can get everything wrong. Methodology, I won't allow you to get it wrong. Because that is where everybody is going to look at. So if I'm not there and then a colleague is the one conducting this thing, and he says, who supervised you, Sam? Then he did this methodology. That's the only thing that anybody will say that the supervisor did not do the work, his or her work. So methodology, that is the only thing somebody can question you. That, for instance, we all know that when you are how to prepare, maybe you are preparing soup, palm nut soup. And we know that you boil the palm nut before. Then you start from somewhere, it's like you don't boil and you start pounding. Then people say, no, this can't be. Is it a new thing that you need to justify? If you cannot justify, then everybody will see from the onset that no, this is not how to prepare palm nut soup. And that is how methodology is. So when you see your supervisor hammering on the methodology, you need to pay attention to, because that's the only means somebody can tell you that the research is bogus, the methodology. If you take the methodology, the others you cannot question. I'm the one gathering my data. And I said when I went, the people said yes, you didn't go with me. But the methodology, how you interviewed them, I can question it. So the next one is the services data. So when you talk of service data, it includes number of services provided, number of service visits at which products are dispensed, tests conducted, episodes of diseases or health condition treated, or number of patients on continuous treatment during the last 12 months period. So you also have service data. You're talking about the footfalls. How many people visited their facility? And after this data, you have it. You are conversant with it, especially the midwife, because you have to record all the cases, the delivery cases that you've done in a month or in a year. And I think it is used to assess you. It is used to assess you. Like you have a check compound, a community with about, let's say, 2,000 to 3,000 women. And a year, you come and tell them that you didn't get any delivery or got just about 2-3 deliveries. It means that they are delivering, but they don't come to your facility. So then you conduct investigation into it. Why this number of people in a community with a facility and they don't come? Are they going to other places? Then what accounts for that? And that is why the research that you are doing is important. So don't think that we are worrying you. It's part of your way. In your case as midwives, it's a practical thing. You need to do that. Because normally the nurses work with the doctors and other things, but the midwives are always posted to rural areas where there are no medical officers and you are supposed to act and do everything yourself. And so you need to, when something is going on in your community, you should be able to research into it to get it. So you look at the product that you dispense frequently, the number of tests you conduct, then you look at the disease pattern, and then those patients who are being treated, those receiving treatment in your facility. You should have statistics on all of these things. And that is why you do what they call it, biostatistics. So you see the importance of biostatistics. It's not an abstract thing. It's there to guide you in the work you do. Then we have the consumption data. You should have the consumption data as well. And they are data on the actual quantities of health commodities. Consumption data includes actual dispense to user data or data on numbers of commodities that were actually given to clients. You need, what do you call it? Consumption data. So the data, consumption data will be what? The number of commodities that you have issued to clients. So we have issues data can also be used as proxy for consumption data. Issues data are data on the number of commodities transferred from one level of the supply to another. So like the adjustment that we talked about. So it might not be the issues that the item that you have issued might not be to the patient, but is a transfer to other maybe facilities. You capture them under issue data. And we say that it's a proxy for consumption data. So we are done with the step 2. Any question before I proceed to the step 3? Any question before I proceed to step 3? Lydia Abule.
Sir, please, can you take the mobility data again? I wasn't so clear about that one.
You were not paying attention, or you were not clear. When you talk of mobility data, you see in your facilities, you collect, you write information or you collect information on prevalence rates. So assuming people come to antenatal and you do tests, how many of them are hypertensive? You get the number of hypertension cases. You get a number of maybe hepatitis B cases. You have data on HIV and then other infections. You look at them, and then you look at the what. Then you have the health conditions of the people, like when they come, what is their health condition? Are they anemic? You need so you can then say that, okay, this community, the majority of the pregnant women or majority of women and children who visit the facility are anemic. And so that would raise a concern. And we can also talk of occurring, these are some of the diseases, the things like, so when we talk of mobility data, is a data on what? Incidence. Okay, the incidents that you record. You talk about the prevalence rates. Are you getting it? So these are data, information on incidents, health conditions, specific diseases within a population.
All right, thank you, sir.
Are you all right?
Yes, please.
Okay. So we are going to the step 3. We've done the step 2. So the step 3 is supply planning. What is supply planning? The supply planning step is used to estimate the total commodity requirement and cost for the program. So when you talk of the supply planning, so we talk about the step 1 is the preparation. Step 2, you forecast. After forecasting, then you go to how to plan the commodity, how to get the total commodities. So the supply planning step is used to estimate the total commodity requirement and cost for the program. So you pick teenage pregnancy. How many products, different products do we need? So you list them. Then you look at the costs. You cost it. After listing them, you need to cost it. And then you'll be able to determine that for teenage pregnancy program for the year. So let's do it, let's say district by district. For your district, this is how much it will cost you. These are the items you will require for the ensuing year, and then the corresponding amount. So to calculate this estimate, you start with the forecasted consumption for each product from the forecasting step. So the estimate, so now you are looking at the product that you have, the quantities and everything that you've estimated during the forecasting period to calculate the total commodity requirement and the cost for each product. You're saying that you calculate this estimate with the forecast consumption for each product from the forecasting step, then consider the existing stock on hand. So you said, somebody says, okay, next year you will need these quantities. You don't just jump into it, you also look at what? The stock at hand. Okay, we already have these quantities. So if we are looking at this estimate, taking into consideration your minimum and then your maximum and the minimum stock level. So when we talk of the maximum, every organization, you know that this is our maximum stock level. So if we are estimating, they will bring their estimate. And the procurement people must also sit down and say that, okay, if estimated next year you need maybe 20,000 antiretroviral, our maximum stock level should be 40,000. We already have that that is the total requirement. And then they look at the stock on hand. We already have 1,000. So if we are going to, when they are planning, then the procurement team will plan for 30,000. They will use 30,000. They will not use 40,000. Because if they use 40,000 and the stock comes, they are going to have 50,000, which will be beyond the maximum stock level. So they always take into consideration the estimate that you have brought. Then they also look at the stock on hand or any quantities that have already been ordered. There are some products, sometimes the estimate that you have brought, they've already made orders for it. So you look at the goods in transit. Sometimes we can say the en route. You pick those goods in addition to the forecasted one and then stock on hand to be able to get your maximum stock level. So you try to avoid overstocking. And that is what the planning, supply planning does. So we are looking at the supply planning process. What are the processes you go through? One, you still organize and analyze data. You see, in each of the stages, data analysis is important. So how do you organize and then analyze your data? You look for the information. You can pick it from records. You analyze it. Then you build supply planning assumptions. You know, procurement, especially at this level, are the procurement of health commodities, because you are forecasting, you are basing your forecast. Everything is based on assumptions. You are assuming because you have the data. It does not necessarily mean that things will be the same. Things can change anytime. So you look at the trend and then you estimate. And so these plannings, you build supply planning assumptions. So you need to make assumptions. And then you estimate the total commodity requirement based on the assumptions, based on the statistics that you have. You make assumptions to determine the total commodity requirement. So after doing that, you develop the supply plan itself. Then you compare the cost to available funds. Yes, we've made our estimate. These are the things we will need. to be able to function properly. Good. But the question is, the funds available, if we look at the cost, can the funds available support? So you need to balance the two. So let us look at building supply planning assumptions. How do we build supply planning assumptions? As with the forecasting step, you will need to make assumptions in the supply planning step to account for missing or low quality data. You will then need to build consensus around these assumptions. You build consensus around these assumptions. So what you do is that you talk of forecast. The first step is forecasting. You need to make assumptions in the supply planning step to account for missing low quality data. You will then need to build consensus around these assumptions. So estimate, you see, forecasting or quantification is not a small thing, you know. And anytime we are doing this, you need to bear in mind the caveat that in supply chain, you're talking about optimizing your supplies. How do you optimize it? How do you do it? So you ensure that you have enough. You are not under-supplying, and neither are you over-supplying. So you work within a budget. That is how supply chain works. You work within the budget. You need to work within the maximum. You have your maximum stock level and the minimum stock level. So when you are making the assumptions, you need to take into consideration these factors. Then let us look at the examples of supply planning assumptions. So timing of available funds. So timing is very, very important. When are we going to get funds for the estimates that we've done? The amount of available funds. So we talk of when are we going to get the funds, and then the actual funds available. You need to also make assumptions for the lead times for each supplier. You need to estimate. So there's a difference between lead time and then arrival date. The lead time is when I place an order, when is the ideal time for the supplier to be able to deliver. Then we are looking at the lead time, arrival date for the suppliers. So I know that when I order for these items, it will take 2 weeks for me to get it. That's the lead time for the supplier. Then arrival date of supply. When do I get these items? If it is going to take me 2 weeks to get it, then when is it going to arrive? So that one will be based on the day the orders or the order was made. Then you have the minimum and the maximum stock level for each level in the system. So every item, you need to set the maximum stock level and then the minimum stock level. Very, very important. You estimate total commodity requirement and cost. How do you estimate total commodity requirement and cost? To estimate the total commodity requirement, you must determine the quantity of each product needed to meet the forecasted consumption. So you need to estimate total commodity requirement and cost. To estimate the total commodity requirement, you must determine the quantity of each product needed to meet the forecasted assumption and ensure in-country supply pipeline has adequate stock level to maintain continuous supply to service delivery point. So whilst you are estimating the commodity requirement and cost, we are talking about the quantity and the total cost. How do you do that? So you do that by determining the quantity of each product needed to meet the forecasted consumption. So we assume that for this item, on a yearly basis, we are consuming, let's say, 1,000. So we need to know for every program. For some program, you need a combination. Like antiretroviral drug, is it just one drug or you have multiple of them? So you have about 2 or 3. If a patient walks in, the person is supposed to be given about 2, 3, or 4 different drugs. It's a combination, or it's just one dose, one what do you call it? Products. Those of you involved in the HIV programs, or none of you is involved? A combination. So how many items do you combine? Or it depends on the 3. Okay, so when you are estimating, you need to make estimates for all these 3 with its corresponding cost. And we're saying that one making estimate, you see, if you don't forecast well, if you don't do your forecasting well, that is why we often look at the stock in hand, because it should be a continuous process. It's not like because you are going to buy, you order and then you run out of stock. It's a continuous process. So whilst making your estimate, you need to look at the stock on hand as well. So the next stage is you compare the cost to available funds, which is very, very. This is basic thing. Anytime we're making estimates, even in our own small way, anytime we want to make projections, for instance, most of you are women. So when you are going to the market, you sit down, you make your projection, you do your estimate. Then the estimate you make will be based on your funds available, the money that you have. That is what you. So there are times you get to the market and you looking at prices, you cancel some of the items. Some of the items you either reduce them or you think that okay, without this we can still survive. So you take some out, and then so it's not easy. And that is how you also do when it comes to the quantification. There are times that you need to take some products out, you need to reduce quantities, looking at the available funds. So let us look at using the quantification results. How do we use the quantification results? The quantification team should formally present the results of the quantification to stakeholders. Okay, so once you are done, you need to submit it formally to them. And then the quantification team should formally present the results of the quantification to stakeholders. During a presentation on the key output from a national quantification exercise, the team should, 1, review all data sources used and include a discussion of challenges in data collection and data quality. So when you are using a quantification result, you need to review all the data sources. So some of the data sources, they are not accurate. Sometimes it is like those who use AI to do your work. AI can give you a source that you can never find the source anywhere. I also it hallucinates. It will sit down, and then when you do proper engineering, proper what they call it, you ask the question, you ask AI question. I want this. I don't want you to include this. Don't include this. Don't include this. I want specific things. Sometimes you tell you that I can't help you. But if you don't do it well, then it will help you and give you wrong information. And because sometimes you are also lazy to verify the source, you put in there. And you will check 1, 2, 3, 4, and realize that the information that you have provided is not there. I was writing a paper with a lady, very good in research, and that's why I've never recommended any of my students to see her. Very good in research. But then now she's been swayed by people, so she's gone into AI. You use the AI to write a perfect research. When you see that, if she writes a research for you, know that she's done well. But when you go back and you try to pick the reference, you pick about first 10 references and you cannot get them anywhere. So we did a study and I showed it to her and she was so sad. So then I asked her, now next time when AI gives you anything, verify if the source is not right. The same statement that it has given you, you can get a study that somebody has done and has passed that, because AI doesn't write. It picks information that people have done and then it puts it in own what do you call it, context for you. And so you need to verify. Those of you using the AI, yes, it has come to stay, but know how to use it. Know how. It is like you having a calculator. AI is you having a calculator in a classroom. If you don't know the formula, if you don't know what you are doing, the calculator will serve no purpose. Okay, so if you know the formula, you know what you are doing, then the calculator can assist you to do your work quickly. So AI is like a calculator. You must know what you are doing, then you command it that do this, do that, I want this, I want that, I want this, then it will do for you. So please, those who have used AI for their work, go back, look at the references, check all the references, and make sure they exist. If they don't exist, there is a way you can go about it, okay? And also try and humanize it. Let somebody take you through AI detector. When it is detected that this is AI, they have a humanizer, but it's a software that you buy, it's expensive. So it will humanize it, then you'll be all right. This secret I shouldn't teach you, but we all learn it from people. We were all taught by other people we didn't know. So this information, I don't want to hide it. You don't get anything, but I want you to do the right thing. I know a lot of you are using it, especially the people that you give your work to. I know most of you give your work to people. That's what they do. And most of them, they are not intelligent enough to humanize the work they've done. And they submit the AI thing for you. And now most of the lecturers are up. It's to be painful when you submit the work and the person will tell you that it is AI. So go back and do all over again. So try and then solve it now. Check all the references. Make sure the references exist. Sometimes it can give you references from supply chain, but the work that you are doing something about maybe infections. So you need to make sure the reference it has given you is about infections and not maybe quantification. Thank you. So let us continue. Then we talk of what? You summarize the forecasting assumptions and description of data sources and key informant input used to, no, the English is no good. So you summarize the forecasting assumptions and description of data sources and key informant input used to inform the assumption. So when we talk of forecasting assumptions, summarize the forecast, all the forecasts that you have made, the assumptions that you have made, you summarize it. And then you describe the data sources, description of data sources, where you got the information from. I think this centers to the AI thing that I was talking about. And then key informant input. So where did you get the information from? Sometimes somebody will query you when you make your submissions. On what basis did you make these estimates? How did you arrive at this conclusion? And then somebody would oh, I got this information from this source, from that source, from that source. It was based on that I drew this conclusion, and then your estimate will be accepted. Then you need to also summarize the supply planning assumptions. What are supply planning assumptions? Especially if assumptions about the amount and timing of funding commitment will affect procurement and delivery of commodities. Okay, you need to summarize the summary planning. Whatever you have done, you need to summarize it, especially if the assumptions about the amount and timing of funding commitment will affect procurement and delivery. So you need to make sure that everything that you are doing is verifiable. So all the supplies, the like the planning assumptions that you have made, you need to summarize it. Especially when you look at about the amount and timing of funding commitment. If it will affect the procurement and then the delivery, you need to look at it well. Another thing that you need to list the total quantities and cost of each product required for each year of the quantification. So you pick a particular product, let's say, glass. You indicate that within the entire year, for the whole country, you're going to need maybe 1 million pieces. You estimate. You do same for all the items that you are estimating. Then determine the national stock status, months of stock on hand for each product. So each of the product in question, you need to also know. And this one will not be done for you. It's not your responsibility to know the national quantity. That's the responsibility of the central procurement team. They would have to handle that. And then status graphs are very useful to convey this information. You need to draw graphs. Graphs are very, very important because, you see, sometimes in school, we are not taught the importance of certain things. So at the primary GHS, even at the secondary school level, we are not taught the importance of these graphs. But they are important. We use them every day. So you draw a graph, okay, and then you highlight the product close to expiry. So you have the product that are about to expire, you know them, stock out items that you've run out of stock, or overstocked items that you have more than you need based on the national stock status analysis. So with this, you are able to get accurate estimates. You know that for this item we don't have. For this item, even though we have, it's getting to expire. And for this, we have more than we need. So you do that to be able to get accurate estimates. Summarize the shipment or delivery schedules by funder and by supplier. So you talk of each item. Gloves will be supplied by maybe NS Chemist by these days. It is funded by maybe the government of Ghana. Most of these items that come from donor agencies, sometimes on the box, you see it from the people of China or from the people of Republic of China with love. Sometimes from the people of this. That's what they state. That is where you get the funder. So you realize that the moment you see the product, realize that this product was financed by this group of people. Then you list the total funding gaps for the next 24 months. When you talk of funding gaps, we are talking about the differences. So your estimate, you've indicated that you need 100,000 cities to procure items for program A. But realize that the available funds are 80,000. It means that you have a gap of 20,000 to add it to it to be able to get 100,000. So you do that for the next 24 months, which is 2 years. You list the specific actions required to address any critical stock imbalances and to maintain stocks at the established levels. So where there are imbalances, when we talk about critical stock imbalances, where you have either overstocked an item, or understock. So you need to look at it. Maintain a balance. There should be what we call optimization, making sure that your quantities to be supplied, quantities received, the demand and supply, they meet. They say that equilibrium where demand meets supply. We need to take it very serious. so that you avoid either overstocking or understocking. Let us look at the presentation of quantification results to policymakers. Facilitate the following. So if you present to stakeholders, it leads to the following activities. One, program planning and budgeting. Once you are able to present it, it helps you to do your budgeting, because once you present it to them, you can't just present, you need to make sure that you have the program planning. So if it is, what do you call it? Teenage pregnancy program, you plan, then you budget, you draw a budget for it, how much it will cost to have the program rolled out. Mobilization and allocation of funding for commodity procurement. Once you present to the stakeholders, they are the financiers, so they'll be able to mobilize and then allocate the needed funds for the procurement of commodities. Then coordination of multiple sources of funding for the procurement. When we talk of coordination, you see, our health system is financed by different groups. Okay, sometimes you have the donor agencies for the mission hospitals, especially the Catholic. They have a dedicated. They have a lot of sponsors. And then I know the APPIAH, the Muslim mission, the Islamic health thing, they also get a lot of sponsorship from either Turkey, they get some from Saudi Arabia, Qatar, and all those places. So some of them, so you need to coordinate to get all these multiple sources of funding for the procurement. You need to make sure you manage to take advantage of them, and then you get that funding. Then the procurement, because when you present it, you're during the presentation, these policymakers, as the donor agencies, are part of the policy makers or stakeholders, so they are able to get you funding. Then procurement decision making about which product to procure, how much to procure, and when to procure. That is a procurement decision. What to procure, how much, and when. Adjustment of time of procurement and shipping delivery schedules to ensure continuous supply while avoiding stock out and overstocking. So you can stagger them instead of what do you call it? Shipping everything like a year's estimate for year 2026. You ship all of them at a go. You're going to face challenges. So you can divide them and say that every quarter we will buy. You can divide them into 3, and then you procure them on quarterly basis, just to ensure continuous supply. So the last slide, we're looking at what? Reviewing and updating the quantification. Quantification does not end after you determine the final product quantities and cost. It is an ongoing process of monitoring, reviewing, and updating the forecasting data and assumptions, and recalculating the total commodity requirement and cost as needed. So the quantification is not one-time exercise, it's a continuous process. Even though you've done the estimates, from time to time, you review it, you look at the trends, you look at what is the happenings, and then from time to time, you make adjustments, you review, you make the updates on assumptions. So reviewing and updating the quantification includes the following activities. 1, reviewing and updating the forecasting data and assumptions. You need to review and update the forecasting data from time to time. Calculating or recalculating the forecasted consumptions using the timed Excel spreadsheet or other software. So you need to always calculate. Yes, this person has estimated it, and this is the cost. So yeah, if you have about 20 items, how much will be the total cost? You need to do it as you receive it. And then updating the stock on hand for each product. Assessing national stock status for each product based on product consumption and stock levels. You need to know. So this is the essence of LMS. You can't sit in your facility and know the national, stock status. No, you cannot. It is through the LMIs. That is a software. And the LMIs, one thing about it is that it has different phases, different interface, depending on your level. Probably at your level, you can only see what is happening in your district. You can't see what is happening in the region, or you are given, some people are given the what do you call it, access to see what is happening in the region, so that they, at any point in time, when they are making orders, they will know the stock available. Then the region may also have certain assets that you wouldn't. The same thing applies to the central stores. So reviewing and updating shipment delivery schedules to ensure continuous supply and maintain desired stock levels. So you need to, from time to time, review, and then you update your stock level to enable you have continuous supply. Thank you. Any question, any contribution? Hello? Debbie?
Sir, thank you, sir. Please, with all due respect, when I answered the question and you were about to explain, my network took me off. I couldn't get anything that you said about what you were saying about the two and this and the explanation was given about the demographics.
No, please, you haven't said anything. Tell me, you can forget about the network. What didn't you get?
No, I said the step 2, where you were under the demography,
The mobility, is it mobility? Mobility data.
So please, I don't know what I so then I wasn't in. So I couldn't.
So you don't write. It means that when you just listen for the sake of listening, you said I've written.
No, I said that all this I wasn't. The network took me off from there. So
from that point to this point, I didn't hear anything.
Yes.
Hey, so I should go over. Then it will take us another 1 hour.
Oh, okay, sir.
Our time is no. Is it no? Tell me the way you didn't get it, or is it from the mobility to this point? Because I think it's at the beginning of the lecture. Or
no, sir. Please, I didn't say the beginning. I said the second step under the forecasting.
So you didn't get the entire second step, or from the second step to the last?
No, from the third step I had it. But second step, when you ask the question about the demographics,
so what I'm saying, listen. Is it from that point to the end that you didn't get?
Yes, please.
Hey, Debbie. Then you have to read it. You have to get the recorded version.
The third step, I had it.
So you didn't get the second, third, fourth.
The fourth one too, I had it.
What about the third?
That one too, I'm having it. But the second to the forecasting, that is my problem.
So the forecasting, so from the demographic, we're saying that we have 4 types of data that you need to get for the forecasting. One is the demographic data, which gives you information about the gender, age. It gives you information, the population characteristics. When you talk of population characteristics, you can talk about, if you pick a population, a group of people, you look at the age, okay? You can look at their age, you can look at the gender, you can look at marital status, you can look at the parity, you can look at the number of children they give birth. Some communities, you see, giving birth to plenty children is a plus to you. And so so you look at all those statistics when you are making forecasts to be able to know the kind of product you give to them. Then we talk about the morbidity data. The morbidity data, you get data on the incidences occurring. So you're talking about the prevalence rate of specific diseases, health conditions, and then other stuff. Then we have services data. With the services data, as a midwife, when you go to your facility, people come in, the services you render. Sometimes you ask them to go and run tests. When they come, you record the results. You look at the disease trend, okay? And then also the treatment given them, and those who are still receiving treatment within the last 12 months. This data, you also add it when you are estimating. Then you come to the consumption data, and they are data on annual quantities of health commodities. So when you talk of consumption data, at the end of the day, you are able to determine the quantity, the amount of drugs, each drug. Maybe you have about, with a program, let's say we're using the teenage pregnancy. So teenage pregnancy, all the items you need, please, all the items you need for your program, you list them, those that they have consumed. There are times that you make transfers, not necessarily consume. Some of the items you haven't consumed, haven't issued to clients, and you've given to other facilities. Here we say that we consider it as a proxy for consumption. When you say proxy, it is nearer, okay, to consumption data, but these are items you've issued to another group of people, so you capture it under consumption. And I think these are the areas you say you did not get. Or Debbie.
Same.
Also.
Sir, I'm okay now. Thank you, sir.
Are you sure?
Yes, please. I've gotten the demographics and the.
Okay. So what you do is that probably when they bring the recorded version, you can look at that area.
So we are not getting any recorded version, so.
Are you sure? Okay, yes, I'll find out from the IT people. Okay, thank you for coming, all of you. I wish you all the best. Happy Valentine to all of you. Any other question? Because the class is ending in the next couple of minutes, as indicated by the IT. So if you have any question, if you don't have any question, then thank you for coming. We'll meet next week.
Thank you, sir. Bye.
Thank you, sir. Happy Valentine.
Thank you, sir.
All right. Bye-bye.
Bye.
Happy Valentine.